medical boards tend to agree with the IDSA. It's a big society,
Sure,
and
yeah.
they have taken licenses away from people who have, in good conscience, tried to help people who have chronic Lyme disease by treating them with infections.
Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent from developing and improve from suffering with brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a physician and Chief Scientific Wellness Officer at Kemper Cognitive Wellness, and I'll be your guide on these sound waves. So whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have a loved one with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's, dementia, and just generally things in life's second half. If you have questions or comments, check us out on social media. To support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show if you find these episodes valuable. That's Patreon, Patreon, patreon.com/evolvingpast. So here we go. Let's get better. Welcome back to the show. We have another really cool guest this week. And this show I want to dedicate to my mother, Susan Bergman MD. She's the #1 fan and supporter of the show, and who was the first and coolest pathologist I ever met. So since 2017, perhaps it's been more acceptable to talk about the idea of microorganisms like bacteria and viruses contributing to being cause of Alzheimer's disease. Even this year, this summer, there were reports of, quote, groundbreaking research out of Tulane with the possibility of connecting Lyme disease and dementia, like it was a new finding. But in the 1980s, our guest today was really, I think from my reading of it, was kind of stirring up scientific debate by publishing and presenting data from his pathology lab that the bacteria Borrelia Burgdorferi, often synonymous with Lyme disease, because of its association with U.S. origins in the town of Lyme, Connecticut, that those bacteria were likely contributing to Alzheimer's. I do think it's important to frame this discussion with the kind of medical standard of care. Lyme disease has a very specific meaning in today's medical rubric. The vast majority of neurologists and infectious disease doctors do not necessarily accept the idea that at this point that Lyme disease may be persistent or chronic or have a role in Alzheimer's disease. The CDC does list post-treatment Lyme disease or as an entity, but they still state there is no proven treatment for it, even though it recognizes the term. But our guest today, Dr. Alan MacDonald, graduated with an MD from Columbia University. Dr. MacDonald is a pathologist, and he has completed over 35 years of research in Borrelia and Lyme disease and has published numerous peer-reviewed articles, presented all over the world on the pathology of Lyme and its role in Alzheimer's disease, dementia, and other diseases. Welcome to the show. Thank you for being here, Dr. MacDonald.
Thank you very much. I'm happy to be here.
I think I first heard of your work, maybe it's 2015 or 16, when I saw the 100 cases of Alzheimer's pathology, like this study, and I was like totally fascinated. And you mentioned this, and it's sort of some of our pre-interview communications that you feel like maybe there's a shift in what's happening in this field. But just to start off, just to give our listeners kind of a welcome in on you and a framework for our discussion, like, can you just remind everybody briefly what a pathologist is?
Well, some people think pathologists are not real doctors because they don't write prescriptions. We do have the MD degree, but then we part company with the rest of prescription writing doctors because we live in the world of microscopic reality. What a lot of people forget is that we're quality control officers, and we are there in the hospital to be your conscience and your prosecutor if you make a mistake. So you're reminded of our presence when you don't make the correct diagnosis. And the autopsy is one of the metrics that can be used to show that excellent, intelligent clinical practice doctors are capable of making huge mistakes by not finding the true cause of the disease, which debilitated their patient or injured their patient or ultimately killed the patient. So one thing you don't want to do is argue with a pathologist who has microscopic proof that you're wrong,
Right.
because we will see you in court and we will testify against you and the jury will find you guilty.
Right.
So
Right. Sounds like you've been there and done that.
they're
So
not to be trifled with.
right. Serious people, right? So what can you just kind of give us a brief primer on just on Lyme or borreliosis? Just what is that? It's an infection. It's a bacteria.
Lyme disease is a special type of infection that's due to a spiral organism that's the first cousin of the syphilis spiral organism. And there are many, many correlations between the things that syphilis could do, and everybody agrees syphilis can do everything in the body, and what Lyme disease might do. Now, what we have is a situation where the limitations of the CDC and the Infectious Disease Society of America put roadblocks around people who dare to say that Lyme disease might do something worse than give you a skin patch or a hot knee or an irregularity of your heart or meningitis, arthritis. So those I call the four cardinal points of the compass of Alan Steer, who described Lyme disease. Lyme disease actually wasn't Steer's discovery. It was the discovery of Polly Murray and Judith Mensch. I like the word Mensch. And they, in Lyme, Connecticut, noticed that there were too many children in their neighborhood who were suffering from arthritis, juvenile arthritis. And, in the school bus, when they picked the children up, they would see that they were children on crutches waiting to be on the bus, and there were too many of them. And so they asked Alan Steer to look into it, and he ultimately described Lyme as an arthritis. And he made his career after that. So he can thank his pension fund to the keen observations of two women in Lyme, Connecticut, who calls attention to this disease, which paid for the rest of his career. I dared in 1985 to do autopsies, and autopsies, of course, are no longer done most of the world, but I did autopsies on babies that had died and either miscarriage or stillbirth. And I found that the Lyme disease spirochete was in their tissue big time, in the brain, in the heart, and the liver. And I published a case of Lyme disease causing a fetal death. And I worked backwards from what I found at the autopsy to prove that unsuspected Lyme disease had actually killed the baby in the uterus, and the stillborn baby showed many not inflammatory, but disease manifestations, where the organs that were removed at autopsy had Lyme disease spirochetes in their microscopic slides. So microscopic slides win. You can't argue against finding the bug at the scene of the crime.
Mm-hmm.
And that was then generalized to study Lyme disease outside of the four areas of Alan Steer and looking for it in other areas of medical concern.
Like
And
where
that's
else
how I
do you
got
find it?
started.
Where else do you find it? Like what other tissues in the body, or where else in the body do you
You can
find
find
this?
it everywhere. They've got every organ in the body can have Lyme disease infection. Not everybody gets the worst case. Some people have it in the skin, and it sort of stays in the skin. At least we hope it does. And then it goes to the joints because it travels by the blood to the skin, from the tick bite side of the skin to other areas of the body. It can go to the brain, it can go to the heart, go to the liver, just like syphilis. So I can really publicly tell you that everything that I have done in my 36 years of medical research is stolen from syphilis.
Mm-hmm.
Anything
Right.
that syphilis can do, Lyme disease can do, and the microscope tells us that that's true.
So that's interesting because we know there's this concept of tertiary syphilis, or neurosyphilis, and this is, kind of leads us into um, our coverage of when you first kind of got involved in the relationship of Lyme or Borrelia and Alzheimer's. Can
Yes,
you kind of tell us about that?
tertiary syphilis is what killed Al Capone. He had general paresis dementia. And since he was afraid of needles, he wouldn't let his blood be taken for study. So because they couldn't test him with the blood tests at the time for syphilis, he didn't get an antibiotic, and that's why he died of syphilis dementia. Um, I was inspired by that exact model that dementia and spirochetes, syphilis are connected. And because I believe that anything that syphilis could do, Lyme disease could do, it's not an unreasonable expectation to look for it. Not only I looked for it, I found it under the microscope in brains of people who had died from Alzheimer's disease. So it's not a huge cognitive leap to say, well, the Alzheimer's disease is well established by the other pathologists who use conventional stains to look for Alzheimer's plaques, but didn't look for spirochetes with special stains. So they might have been missed. The George Gwenner Brain Bank gave me 4 brains for people who have died of late Alzheimer's disease. I received them in frozen state. I thawed them. I put them in culture. I grew spirochetes of Borrelia in 4 of 4 cases. I looked in the brain. I found spirochetes in 4 of 4 cases with the premier detection methods, which were monoclonal antibodies, not just silver stains. I found them in silver stains. And so I published my work in the Journal of the American Medical Association, which is a first-rate journal, equivalent to the New England Journal.
Sure.
In 1986, I submitted my article as Borrelia Burgdorferi in the brains of people who died from Alzheimer's disease. The editors thought the article was interesting, but they thought that it might scare people by the possibility that they would believe that if they had Alzheimer's disease or they had Lyme disease, they were doomed to get Alzheimer's disease. So they made me concede to rewording the article so it was published as Borrelia spirochetes in the brains of people dying with dementia. And I didn't specify what type of dementia it was. That is the first in the world report of spirochetes in Alzheimer's disease, confirmed by culture, confirmed by microscopy in 4 of 4 cases from the George Gwenner Brain Bank. This idea is mine. This idea, I put my flag on the top of the hill in 1985. In 1984, Dr. McCloskey began her work, and she verified everything that I did in 1985. Other people since then have looked at this and been rewarded with positive results. Now, there are people who look at Alzheimer's disease and say, well, it couldn't be. There's too many, and Lyme disease isn't everywhere. And, I think the answer to that conundrum is that we now know that Miyamoto Borrelia can behave like Borrelia Burgdorferi.
That's another kind of Lyme. That's another kind of
species, yeah, but it's first cousin. But it is a spirochete. It can wind up in the brain. And I found Miyamoto Borrelia in Alzheimer's disease plaques too. So I think that there is no question that in select cases, the infection can be found in the areas where the brain is diseased, not in the normal brain, but in the area where the brain is diseased, and specifically where Alzheimer's disease fingerprints are present in the brain. Inside those fingerprints, you find spirochetes or you find spirochetal DNA.
That's the amyloid. Those are the amyloid plaques we're talking about?
Inside the amyloid plaques are biofilms of Borrelia. The amyloid plaques are not dead areas. They're living, breathing colonies of Borrelia in a biofilm form that are secondarily covered by amyloid, which is an antibacterial substance.
What's a biofilm?
Biofilm is a community, like circling the wagons in the Old West. These spirochetes can create a community where they're surrounded by a goo that's called an extracellular matrix that protects the spirochetes inside the goo from being attacked or destroyed by antibodies or antibiotics. So it's a protective device. It's a device for the spirochetes to establish priority in that tissue. They do not grow in culture. Biofilms will not grow in culture. So they don't announce themselves with positive culture, but they announce themselves with positive DNA of the Borrelia inside the biofilm. So it makes it a form of chronic infection. And so this defeats one of your other introductory remarks that Lyme disease is never chronic. Of course it's chronic. Syphilis was chronic. arthritis is chronic. It's chronic if it lasts for more than 3 to 6 months. My patients who died of Alzheimer's disease had it for years, 26 years, 30 years. We don't know exactly when they were infected, but that's like syphilis. Syphilis was what's called a tertiary type of infection, because you would get syphilis when you're a sailor stopped at the port and you get a chancre on your genital from a person who you had sex with, either man or woman, in the port, and then you carry the syphilis spirochete for your entire life, and at the end of life you would die of syphilitic dementia. It's a long-term situation. So this long-term thing is now given credence because the Hopkins Laboratory of Lyme Disease has now coined a rubric, long haul Lyme disease. So all of the people on the other side from the IDSA who said no chronic, and Steer says no chronic, are now defeated because Hopkins now believes in long haul Lyme disease or chronic. And biofilms are an emblematic feature of all chronic Lyme disease infections. Where there is chronic, there you will find biofilms.
Gotcha. And so you're going back now to the 1980s. Why do we have to wait until very recently for, 35, 40 years later? Why do we have to wait for Johns Hopkins to coin the term long haul Lyme disease or, Lyme dementia now? Like, why is that something we're just seeing in the last couple of years? Like, what happened in the interim?
In the interim, there was political action, not medical science action, but political action on the part of members of the Infectious Disease Society of America to prosecute doctors who believed in Lyme disease and to take them to court and try to take their license away. There was also political action to intercept manuscripts for publication and deny them publication because the content of the manuscripts, which described chronic Lyme, was not permissible to the Infectious Disease Society of America, so that you couldn't publish in many legitimate medical journals. And they also had a public awareness campaign where they, on their website, the American Lyme Disease Foundation, said, there is no such thing as chronic and Lyme. There is no such thing as death and Lyme. There is no such thing as dementia and Lyme. There is no such thing as dead babies in Lyme. And that's their public relations campaign. They publish a very comprehensive website which shouts down all of the concepts which are in variance with their belief of Lyme's always easy to treat and that can always be cured.
So there was this pushback from the main organized medicine society, the Infectious Disease Society of America, which seemed to really resist, and then you're characterizing that they were actually going after, and this certainly is fairly well documented, if even in a quick Google search for someone, but where they were. Uh, Standing in the way of the possibility of treatment. And again, somebody that wants to look up that, they can pretty easily find the details. So you're
Well, even more,
publishing.
let me just put in an addendum. The leaders of this activity against chronic Lyme and against other infection manifestations are persons who, in their conflict of interest statement, say, I am a paid witness in malpractice suits against Lyme disease practitioners. And they get money from testifying in court in proceedings which attempt to take the medical licenses away from people who dare to treat Lyme disease in a chronic form or in any form other than the four cardinal points of Dr. Steer. It gets very, very vexing because medical boards tend to agree with the IDSA. It's a big society.
Sure,
And
yeah.
they have taken licenses away from people who have, in good conscience, tried to help people who have chronic Lyme disease by treating them with infections and
Right.
antibiotics.
Absolutely. So that's a good point. So, but if we can, let's see if we could stick with the literature and the sort of the scientific merit of each side here. So you published these findings, and then you mentioned Judy
McCloskey.
McCloskey also
Yes.
with a background. So she sort of repeated your work showing that it wasn't just some magic thing that you had coaxed up in your lab, but that this was verified secondarily by her. Since then, have there been other people, other scientists? Like, who's doing the most credible research now? I mean, I think you've mentioned Dr. Allen and Dr. Sappi. Like, can you kind of speak about the state of affairs regarding Lyme and Borrelia in the role of Alzheimer's?
Or if you want to just argue public publications, peer-reviewed publications, then you have correctly identified Judith McCloskey, who has the largest body of work. She has, published many more articles than I have, but on the same topic. And then recently, Dr. Herbert Allen, who is at Drexel. Dr. Allen has argued in favor of biofilms. And Dr. Allen actually learned about biofilms when I went to Drexel and did a grand rounds on Lyme biofilms. I did a grand rounds, and at that time, he was not aware that Lyme disease in biofilm form could exist. Since that time, he has published many articles supporting the idea that Lyme disease in biofilm form can exist. So, in addition to that, the biofilms bind amyloid. Now, amyloid in microscope is in plaque deposits, which are round areas of what look like deposits of amyloid, and they actually contain inside the amyloid deposits underlying communities of living Borrelia in biofilm form. Furthermore, amyloid has been found at Harvard in their work that amyloid is not a toxic protein, as the current Alzheimer literature would say, but amyloid in certain circumstances is an antibacterial agent. So when the antibacterial amyloid is deposited on the surface of infected tissue and infected biofilms bind the amyloid in a form that exactly mimics an Alzheimer plaque, you have very good evidence that the amyloid is there as an antibacterial agent and not as a toxic agent. And that holds forth with other amyloid diseases. Amyloid in chronic diseases is something we all learned about in medical school. It's been around for a long time. But Dr. Tanzi and Dr. Moore at Harvard, Dr. Moore passed away, but proved with elegant studies that amyloid is an antibacterial substance. So it's like a body's type of antibiotic working against the infection that the amyloid is covering. That's pretty elegant. That raises my flag, and I salute them for that.
And how about Dr. Sappi's work? Eva Sappi at University of New Haven?
Dr. Sappi and I have collaborated for many, many years, and we have a paper now that's been accepted for the Journal of Alzheimer's Disease. The lead author is Dr. Ali Sanjani, and it's been accepted for publication. The gist of the article is that amyloid-coated Borrelia biofilms are real in Alzheimer's disease. How's that?
Yeah, so that's interesting. So, but so is it? So you mentioned one of the premier Alzheimer's researchers, Rudy Tanzi, and his late colleague,
Dr. Moore.
Yeah, and Dr. Moore's story was fascinating. I mean, he talked that for years they had trouble getting funded because of the notion that we couldn't that microbes or infections, bacteria, weren't playing a role, and it was
That's
just
politics. That's not science.
Right. No, I'm here. So I'm hearing you. That's the case we're trying to
politics.
build here. You were trying to build
Science,
the case.
politics.
Right.
Yeah.
And then you have Dr. Sappi. You have you mentioned Hopkins, Dr. McCloskey, like Dr. Allen. So at this point, you feel. This was maybe clear to you 35, 40 years ago, but it's no longer controversial to say that Lyme has a role in Alzheimer's disease. I mean, that seems fair to you.
Yeah. In addition, the World Health Organization just this past month has revised their official list of numerical approved medical diagnoses to add Borrelia-related dementia. Just like there's syphilis-related dementia. Now they've allowed Borrelia-related dementia. There's a numerical code for it. You can code for it in the medical record. They can't sue you anymore for making that diagnosis because the World Health Organization has said that Borrelia infections can cause dementia.
Yeah. So
QED.
good, right. So let's maybe move to the next step here. And does the and I know you're not maybe a clinician in the sense that you see patients that are in front of you, but you see patients' tissue. You've mentioned autopsies. Is there anything kind of unique about the presentation of? Well, let me ask a question before I ask the presentation of. But when you look at autopsies, I mean, of people with Alzheimer's, does everybody have it, or is it just like 40%? Do you have any sense of like how many is this, or is it like every year? Are you claiming every single person with Alzheimer's has exposure and has some kind of Lyme or Borrelia in these plaques?
That's an overcall, but I think that if the percentage, let's say, is 30%, and how many millions of people have that 30% equation, is a major public health problem. It may not be 100%, but I believe that Alzheimer's is, by any virtue of infection-related pathway, an infectious disease in which the chronic infection in the brain wreaks havoc and causes the brain cells to be killed and the amyloid plaques to occur. The amyloid plaques used to be considered dead zones. Amyloid used to be considered toxic. Now that idea has, they tried to make anti-amyloid drugs and hopefully get a cure for Alzheimer's disease. That attempt has always failed. So if you want to invest in a pharmaceutical company that's promoting anti-amyloid therapy, you will lose. You will lose big money because there are new things on the horizon. The National Institutes of Health has now funded research focused on the relationships between infection and Alzheimer's disease, or the microbiome. That's all the bacteria in the gut, and Alzheimer's disease. It's legitimate now for public discourse. It's legitimate for government funding. It has microscopic support by looking at autopsies and finding the agent at the scene of the crime. That's a forensic tool. The agent of injury is present at the scene of the crime. I mean, do we have to draw you pictures? No.
Right. Oh, for sure. Yeah. Everyone wants to see pictures, wants to see simple. But I get I catch your drift here. So how does one go about getting a diagnosis? And this is what I was going to ask before. I know you're not a clinician per se, in the sense that you've met with patients, but obviously, a doctor, physician, doing making very important contributions on the pathology side. How, does someone that comes in with Lyme or Borrelia related dementia, do they look different than your standard Alzheimer's patient? And then how do we go about a diagnosis? I mean, is there a way to get a diagnosis other than someone passes away and we find it in their brain in autopsy?
Well, not everybody with a dementia or a brain fog from Lyme disease is doomed to have Alzheimer's disease.
Right.
That's an early form fruist, as some people would say, of the activity of the agent causing inflammation in the brain, which causes clouding of thinking. There are ways that you can deal with that and actually cure it if you use antibiotics in high doses by intravenous route over long periods of time. In the past, if you did that, you would be sued and your license for medicine practice would be taken away because the IDSA police would come in and prosecute you. Now it's no longer a prosecutable license endangering practice. Now it's a humanitarian, excellent medical practice maneuver. I mean, if you had somebody with syphilis and had brain deterioration,
In the hospital.
you failed to treat that patient with syphilis with antibiotics, then that person can come back and take your home, your pension fund, and the gold in your teeth. And that's all your medical license for failure to diagnose and treat.
So
So
how is it that I'm no expert. I maybe read a tiny bit more than maybe your average physician, internist, but still, my understanding of the diagnosis is it's very tricky because the limitations that most of us are either doing blood tests. If we're lucky, we'll get some kind of spinal tap and get some cerebral spinal fluid, and maybe you can see something there. How does someone get a reliable diagnosis now? I mean, are there tests that you feel like, I mean, is that really, okay, this is the test that will tell us, or it's a clinical diagnosis, it's a suspicion?
No, I think that you have a suspicion, but in order to make a diagnosis, you need precision medicine facts. So you can't just go on a hunch.
Right.
You don't practice medicine by what's in your gut feeling. You get analytical studies and you
Data, yeah.
determine that those support your clinical hunch. Now, what is available? Well, people look at blood tests, and blood tests in Lyme disease are like ham and eggs. Everybody thinks about it. They're not very good. They're not very good in the earliest phase because erythema migrans, that lesion on the skin, is all that you need to make a bulletproof diagnosis of Lyme disease in the early stage. So your eyeball beats the serology blood test every single time in early Lyme disease because early Lyme patients don't make antibodies that can be measured. And so the skin thing is enough. The spinal fluid is not done very often in people who have Alzheimer's disease. You go to medical records and find how many people with Alzheimer's disease have a lumbar puncture. It would be a fraction of a
Yeah,
fraction of a
yeah, less
percent.
than 20%. Yeah.
If those spinal fluids are then processed in the usual way, you get a cell count, you get a chlorine, a chemical study, you get a culture, you get a
Some proteins, some
cytospin.
albumin. Yeah.
That's what we call just the usual, round up the usual suspects. If you want to get to the issue of whether that's related to a spirochetal infection, you have to do spirochete selected testing methods. So what can you do? You can look for the actual spirochete in the spinal fluid by doing stains, by looking at it under the microscope. Pathologists don't do this. Pathologists don't support this. But if you do it, you'll have a very good yield because there are things that you can find in the spinal fluid that tell you that there are spirochetes there.
So
That's
who's
how
doing?
Miyamoto got on the map. They did a spinal tap of somebody who had a brain fog, dementia, and they found the actual Miyamoto spirochete in the spinal fluid. That one did not grow in culture medium, but it was there under the microscope. You went to look for it.
So is this something? Because again, my understanding is that this is not the case. Like, how does someone that's struggling with dementia, like, where would they go to get this? Is this like, hey, you can go to your local neurologist with
No,
a
you can't.
specialty, or like, is it practical at this point to get these?
I think that it's doable, but is it real? Doable is different from real because I can do many tests on spinal fluid. I can look for the DNA of the bug, which has escaped from dead bugs and it's now in the spinal fluid. I can find DNA of the bug in spinal fluid of people who have Alzheimer's disease dementia. I
Right.
can find it in the blood. And they say, well, the Borrelia doesn't really persist in the blood. It gets into the skin, and then it might have a little bit of blood, phase circulation stage. And it really is not feasible to try to culture blood for Borrelia to see if it's there in a form that you can't recognize. It is feasible, and it is there. You can look at it with special DNA tools. You look at it with silver stains. You can actually do a brain biopsy of a living patient. In the old days when they had syphilis wards, they would line the patients up and they put Novocaine into the skin of the forehead and do a drill through the bone and do a small needle biopsy of the frontal cortex of a
Hmm.
syphilitic patient and find the spirochetes of syphilis in the brain of the people with dementia. You could do one of those in your office, for God's sakes. It's not a major neurosurgical procedure. There's lots of ways to help living patients who might have infection with Lyme and actually be headed towards dementia to intervene by finding evidence bulletproof evidence of the infection in the infected site.
Do you know of anywhere that's happening on
No,
a fairly routine, no, on a
no, I've
routine
been
basis?
preaching it for 35 years, but I'm a voice in the wilderness.
And there's
Not even the burning bushes wait, listen to me.
so practically speaking, we know that we're pretty convinced
In
um,
select cases,
in select cases of Alzheimer's
the infection is discoverable.
okay.
Now, I'm not saying in every patient, but if the percentage is 10%, 10% of how many millions is a real number?
Yeah, sure, for
If the
sure. Yeah,
percentage is 30%, how much is that a real number?
very much so.
If the
Yeah.
percentage is 40%, how much is that a real number?
Is
Every
there
single patient who has an infection-related dementia and is not diagnosed properly and treated properly is a malpractice suit waiting to happen. And they're not happening yet, but they will. And once malpractice suits happen for failure to diagnose, physicians will change their practice.
Yeah, that's
That's
for
how
sure.
you
Yeah,
get
no doubt
physicians
about it.
to
No doubt
change their
about it.
practice.
Yeah.
Nothing like a letter from a lawyer gets your attention.
And
And
then
I'm sorry to have to say that, but I've been Minnesota nice for many years, and
right.
now I'm New York. Now I'm New York aggressive.
It's okay. My dad's New York aggressive, and he's a recently retired medical malpractice attorney. And so, I'm
Good.
familiar with those letters.
He can
And
make a nice living if he
right,
wants to do failure
well,
to diagnose Alzheimer's. He can
well,
he can he can make a very nice living at that, and I will offer to do pro bono.
so let me push back a little bit because I don't think at this point you could claim medical malpractice because there isn't really a practical way to diagnose it, from what I'm understanding from you. Like, how could you blame someone like a clinician, even if they wanted to, right? So I'm looking, let's say, for my patients because I am tracking with this, but I need a practical way to diagnose it, and there isn't a way at this point. So that becomes very frustrating for both clinicians and patients, as you are no doubt aware.
Right. So I think you first have to do an autopsy. If the autopsy is positive, you're toast.
So
That's why people don't want to do autopsies because they don't want to be blamed for things that they didn't correctly diagnose. That's part of why we don't have autopsies anymore because if we find something and it's something that could be treatable
right.
and you didn't do it and you didn't think of it, you're toast.
No, but when
So
you
people
say
don't want to be
I don't.
prosecuted for things that they missed.
No, that I totally understand. No, that's so taking it out of the realm of a sort of a medical malpractice. Usually, malpractice is if it's if the standard of the available standard of care wasn't followed, and here what we've sort of set up was that with the first half hour of what we're talking about is that it's absolutely not the standard of care. And in fact, there was antagonism against it being the standard of care to treat persistent so-called chronic Lyme, and now related to Alzheimer's, there just isn't a way to diagnose it unless you find sort of an interested pathologist. If you have an interested pathologist with the adequate tools that kind of knows how to look for it, right?
That's true, but I think that we have an opportunity to learn from what's now peer-reviewed published stuff. And so even if you didn't actually have an autopsy or a DNA test by MacDonald on your spinal fluid or DNA test in your blood of spirochetes in the Alzheimer pre-death patient, finding that's in there with a DNA test, then you are not able to go forward with a lawsuit. The terrain is going to change. So this is sort of a harbinger of what's going to happen when people accept the new World Health
Organization,
Organization approved medical diagnosis by the World Health Organization of the reality of Lyme dementia. There's now a number code for it.
right?
Therefore, if there's a number code for it in the medical record, it's approved by the World Health Organization. There is a substrate for people to work backwards from that. And malpractice lawyers are very, very good. There's something called vicarious liability. Does your father know about that?
I'd have to ask him. I'm sure he
Well,
does.
vicarious means that you may not have been there, but if you participated in a material way for failure for that diagnosis to be made, you are vicariously liable. So if you're a physician and you have a nurse practitioner and your nurse practitioner screws up, although your hands didn't touch the patient, your nurse practitioner did, you are vicariously liable.
Right.
Vicarious liability is one way to crowbar our way into changing attitudes.
Right. 100%. So let's shift it into, okay. So diagnosis remains challenging at best, and somebody has a if somebody with Alzheimer's, and this happens to me from time to time, and they have even they have either a story um, of a tick bite with a rash, which, like you've said, is the synquinone. That's that means they have Lyme trend. They've had Borrelia, at least
No,
Borrelia.
it's too late because remember, your Alzheimer patient can't remember what they had for lunch yesterday. They
Well,
won't
so
remember the
so
tick
I
bite.
would that I would
Will
actually push
remember
back on, because the view of my view and my experience working with people with Alzheimer's is that people are coming in earlier and earlier. Part of the reason we started this show was to get
that.
the word out that not to wait until somebody's sort of in a
Right.
nursing
Okay. But
home.
I mean, assuming that you're a little farther along, if you had a tick bite 30 years ago, even if you're cognitively intact, you might not remember it. I think that there are gaps that are normal and physiological and not demented related. But uh, the whole thing is that in order to really grasp this, you have to understand the concept of tardive disease. Tardive comes from the French word tardif, and it means that there's a long, long gap between the inciting event and the disease event. So tardive things unfold over 30 to 40 years. I had herpes zoster. I had the chicken pox at age 5. I've had 2 episodes of zoster. How did that zoster happen? The zoster has been living inside my neurons quietly, unobtrusively, and I'm 74. And that is what I had when I was a 5-year-old child with chickenpox. And it's been living there, not doing any trouble. And then for some mysterious reason, it reactivates and it causes the painful blisters on the skin. It travels inside the nerve, migrates down, causes vesiculation of skin pain, agony. That's a tardive disease. The time scale for that one, in my case, was the sum of 74 minus 5 years old. How many years is that? That's a tardive disease equation. You've got to think about tardive disease in many, many other situations of neurological Lyme disease because it takes a while for it to reactivate. It's living in the body in a form which is beneath our horizon of visibility, but it's there. And if you can find it early and treat it, then you could prevent the tardive worst case scenario from happening.
And, and
QED, tardive, TARDIVE, tardive.
got it. Got it. Sure. Tardive dyskinesia is the first thing that comes up when I think about it. And then, of course, the Kansas City Chiefs offensive lineman, Laurent Duvernay-Tardif, who's actually an MD, who's one of the rare MDs actually playing football. So if you from Canada, French-speaking Canada, shifting to kind of maybe one of the last things we can cover is the treatment side. Again, I know you're not a treating physician as a pathologist, but can you maybe lay out where you think things are regarding treatment? As kind of a curious, open-minded person, like I consider myself to be, I'm still not sure how I feel about some of the treatments I hear about. You mentioned, longer term IV antibiotics, but do you have any clear insights from where you sit? Like there's
Well,
IV
I'm not,
antibiotics, there's
yeah,
chemo, there's all kinds of
I'm
things.
not credentialed. Credentials are stuff that you can say, well, I got the piece of paper saying I can do this.
Right.
So I'm not credentialed in treatment, but I have an opinion.
Yeah,
And
I'm curious
I
your
know
opinion.
that in syphilis, it was eradicated after 1942 for all intents and purposes in the United States because something happened. What happened in 1945? They released penicillin to the public. When penicillin was available to the public, not for the military, but for the public, syphilis went away because people who got treated with antibiotics at that time, penicillin, were cured of their syphilitic illness. So antibiotics, even a long time after the disease got started, can uh, cure syphilis. Now, Lyme disease has biofilms, and biofilms are important because although a single little spirochetes wiggling around in the blood or in the brain, all by themselves, can be cured with appropriate antibiotics in high dose, a high enough dose to kill the bug. When they round up in biofilm communities and are surrounded inside the goo, the biofilms are resistant to antibiotic therapy. So the bugs continue to live on because the goo is there to prevent harm to the internal residents of the biofilm from either antibiotic killing or immune killing or any other way. So you have to treat this as a biofilm disease.
Mm-hmm.
Biofilms are notoriously difficult to eradicate with antibiotic therapy. Biofilms can infect prosthetic devices that are put in the body. And once you have an infected prosthetic device, the device has to come out. Antibiotics, will not cure a prosthetic joint infection. Those infections are always, always, always biofilm infections, not little single little things. They're biofilms. And the biofilms are the goo, and the goo is sticky and it sticks to the metal prosthesis or the plastic prosthesis, and it makes it impossible for antibiotics to cure. Now, there are newer methods of treating biofilms that have been developed at Hopkins that include the inclusion of drugs that are the first cousin of chemotherapy drugs in cancer, daptomycin, those things.
Mm-hmm.
So those are one possibility where they are developing biofilm-specific infection treatments, and they usually are three or four, probably three types of antibacterial therapies
Chemotherapies.
in one patient, and you do it with a pulse. You pulse 1 week with one, and then another, and you don't give them everything at once, and you allow the patient to recover because there's always healthy microbes that will get killed by these antibiotics too. And you want them to come back. Healthy microbes are your friends, and biofilms of pathogens are your enemies. So you have to do a biofilm type approach, and those things are being worked out. And I think that they will come to pass.
So this you've given us so much to think about. I mean, really, you've been at this it's 40 years now. You've been sort of the tip of the spear. I would say bravely and at some personal and professional cost. No doubt, this is it's hard to be out on an island, but you've had a cadre of clinicians now repeat your work. So you mentioned the World Healthcare Organization adding a diagnostic code very very recently for Borrelia related dementia. So it's Lyme related dementia. It's pretty clear from your work that at least some percentage of Alzheimer's disease, Lyme disease, could be implicated in some percentage. Who knows how much, but some percentage of Alzheimer's. Testing at this point, diagnostic testing to confirm is still it's possible, but
But
it's
not the commercial
impractical.
laboratory methods of
Right,
testing,
right. It's
not the
possible.
old fashioned methods. Serology, those are antibodies in blood, antibodies in spinal fluid, are going to be disappointing. You have to use DNA tools, you have to use microscopic tools, you have to use 21st century detection methods. We're now living in an era where people are living in a 19th century medicine when Lyme serology is all that you have to bring to the party. Well, you're not going to get through the door of my house when you just have a gift box of Lyme serology. You better come with DNA tools or you're not going to get in.
And what about this IGeneX test that's so controversial out of California? Do you have
Hygienics
thoughts
is
about that?
still using serology. They're using Western blot or immunoblot methods. They have some fish, but although my fish is a method for finding with fluorescence a DNA deposit of the Borrelia DNA in an area like blood or in tissue or in spinal fluid.
Mm-hmm.
They haven't rolled out the fish test yet. They know how to do it, but they haven't done it yet. Now, there is one exception, which is that I have discovered that glioblastoma tumors, five of them, have Borrelia plaques and Borrelia spirochetes in the glioblastoma tumors.
Oh, wow. Well,
You can take a breath now. All
yeah,
right.
no, ironically, that's what
All right. So
my mother had.
glioblastoma and now Lyme disease. I have found that Lewy body dementia, which is not Alzheimer's, but it's the first cousin, has Borrelia DNA and Borrelia proteins inside the Lewy bodies. So Lewy body dementia is adding to the list of dementias, which are now associated by pathology studies, few but significant, with chronic Lyme infections. So we're going to be moving on towards the corticobasal degeneration, Parkinson's dementia, and all the dementing illnesses. I'm looking at specimens from those things to expand the repertoire of possible diagnostic and therapeutic interventions in those patients in the hope of helping patients.
Amazing. And then, so we've talked about limitations in testing for sure, but, the technology is there, but not ready for, call it maybe not ready for prime time, not
No, it's not
available.
ready for prime time. You have to wait, like Isaac Asimov said, when quantum mechanics came along, you had to wait for all the Newtonian physicists to die off because the Newtonians wouldn't let the Niels Bohr quantum mechanics guys come through. So you had to wait for die-off. And that's what I'm hoping is going to happen. You're going to have die-off of all the trolls, and then you're going to have a new generation of enlightened people like you permit the publication of articles linking infection and dementia. We hope for that.
Okay, excellent. And then, we covered a little bit about treatment and, the idea of antibiotics, but that probably is inadequate for the kinds of ways you're seeing and you've observed and others have observed of these Lyme disease or the Lyme bacteria protecting itself in the goo with biofilm and then overlaid with a coating of what used to be called or known still in some circles as toxic amyloid plaques. Those inside those plaques or this goo with that are hosting these infections. So got to figure
Well,
out.
let's subtract toxic from amyloid. Let's say
Right,
therapeutic antibacterial amyloid.
right.
And let's say that the amyloid is like the frosting on the cake. The rest of it is goo from the carcasses of once living, now dead bugs that create a goo that protects the living ones inside. So we have to think of a biofilm type awareness to diagnosis and to treatment of people with chronic Lyme illnesses. And let's let the biofilms kind of usher us out of this interview because we have no more time to talk about it. But biofilms are like plastics in The Graduate. Remember? Dustin Hoffman.
Yeah, sure.
Plastics, right? That's what
right.
it is.
Plastics, man. That's right. Dr. MacDonald, thank you for your persistent contributions, your willingness to come on the show and talk about things that are remain, at least aspects that remain somewhat controversial. Although, it's the brave work that you've done and others that seem to be moving this forward. Hopefully, this will end up helping a lot of people. Thank you so much.
Thank you, Dave. Bye.
So that's our episode. I hope it was useful to you. Check out the show notes on iTunes or on our website where we've summarized the key points. If you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. If you have questions or comments, connect with us on social media. Finally, to support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show. That's Patreon, Patreon, patreon.com/evolvingpast. Thanks, and talk to you next time.